Hey folks, this is Dr. Jean-Guy. Today I'd like to talk to you about a subject, the subject of scoliosis. So maybe many of you here or some of you don't know what that is, but a scoliosis is, I'm holding a spine right now. This is a spine, if you did not know, right? And this is the top of the spine, that's your skull bone, and this is your tailbone. And we're looking at it from the side, and you should have curvature in your spine. Curvature in your neck looks like a banana. You have a reverse banana between your shoulder blades and also a banana on your lower back. That's what it should look like when you take an x-ray of your spine. From the front, it should be straight. By definition, a scoliosis is when your spine is going from side to side from the front, right? That's what we call the scoliosis. So you might have heard some people, maybe your children, maybe some of your friends' children have a scoliosis, and basically what that means, maybe some of you've never heard of, this is what a scoliosis is. What can you do for a scoliosis? Medically, oftentimes, we're just going to watch it as it gets worse, and then it gets to a point that maybe you might need to have surgery. However, there's some great technology now that we did not have the tools before of, having ways to be able to address that depending, how much the curve is, As the curve is starting to develop, oftentimes chiropractic, very specific corrective chiropractic care can help with that. And then you can also, if it gets to a point where it's more than, a certain number of degrees, right, in terms of having a curvature in your spine, then you might qualify to have a brace. So we started to brace people just a few years back, and we're using this thing here, and I want to show you, this is called a Scoliosis Brace. And those Scoliosis Braces are designed, they're mechanically engineered after you take an x-ray. They're mechanically engineered in 3D. We scan the patient, we take an x-ray of the patient, and then we mechanically engineer the brace that it's going to fit perfectly, as you can see here, through the brace, that there's some areas that are not, this hole here is not like just a circle, right? So there's some areas that are pushed forward, there's some area that will push you from side to side, and basically what that is it's designed, right, not only to prevent further progression of your scoliosis, but it's also designed for correction purpose, which is really exciting. We've never had this technology before, or at least never had technology that worked, right? There's a lot of different braces out there, and most of them, at best, they will prevent further degeneration. But this particular brace, it's called the Scoliosis Brace, and what it does and what I love about it is not only we can expect further progression, but we can also expect correction in the majority of the cases, which is really exciting, depending of, the cases and the stiffness of the curve, and there's a lot of different things that plays a role into that. The other thing that I want to share with you is most of those braces, usually in the past were used for kids that have scoliosis, but today there's a great segment of the population of adults, by the time they pass to be 50, 55 years old, that their scoliosis will start getting worse, and as a result of that, their activity of daily living will be reduced, and they can't do anything because they can't move well. And guess what? Those people can also benefit from using a brace that they will use just like at night, for instance, and it keeps them mobile and they can keep doing the things that they want to do. So anyway, hopefully this was helpful on the topic of scoliosis and you learned something today. If you want more information, just come on over to our office. Our phone number is 517-336-8880. 517-336-8880. You can also look us up on our website. It's called achiro.net, achiro.net, and we have all the information on scoliosis and bracing and how we do that. So hopefully if you have any question, or somebody in your family, somebody that you know, send them our way and we will answer all the questions that they have. We'll talk to you soon. Take care.